TJ Watt of the Pittsburgh Steelers suffered a friendly fire collision tonight, which resulted in him being ruled out for the rest of the game. As of right now, we don't know too many details regarding the specific injury to TJ Watt. However, we do know that on the actual play that he was injured on, his knee went into a very awkward position known as hyperextension. The positive news is that Watt was able to walk off with his own power. However, he was ruled out very quickly after the injury. Knee hyperextension is extremely risky for several structures located within the knee joint, and that's something I really want to focus on with today's video. Ladies and gentlemen, welcome to my channel. If you're not familiar with me, my name is Nick Gallo and I'm a doctor of physical therapy. And with my channel, I take a look at sports injuries and I explain them so that they're a little bit easier to understand. I will also go over the relevant anatomy of the injury as well as talk about what that person should expect when coming to rehab. If you like this sort of content and you enjoy it, please hit that thumbs up and subscribe to the channel because I will be making more of these in the future regarding sports injuries, rehabilitation, and other physical therapy related content. Also, if you have any comments or questions, please leave those in the comment section below. Now we can see here on the injury video that as teammate Montravius Adams is walking, he's going to make contact with the front of TJ Watt's knee, making it bend backwards very awkwardly in the hyperextension position. Here I have a model of the knee joint, and so the knee is formed by that femur, also known as that thigh bone, that's going to come down and form the top portion of the knee. Then we have the tibia, also known as the shin bone, coming up like here, and it's going to form the bottom portion of the knee. As we flip the model laterally or towards the side, we have the fibula bone, which is also located in the lower leg. Now there are four main ligaments that contribute to overall knee stability in the knee. The first one is that anterior cruciate ligament, or the ACL for short, located right in through here. As we flip the model medially or towards the inside, we have the medial collateral ligament, also known as the MCL. As we flip that model laterally, again, we have that lateral collateral ligament, also known as the LCL. And finally, as we go towards the back of the model here, we have that posterior cruciate ligament, also known as the PCL. Two other important structures are located within the knee joint itself. They are the medial and lateral meniscus. You can think of these structures essentially as pieces of fibrocartilage that are shock absorbers between the two bones. Let's talk about the two main motions at the knee. The first motion when the knee is going to be bending, this is known as knee flexion. And the opposite of that, when we're going to be straightening the knee, this is known as extension. So let's talk about what hyperextension is because it's very applicable for this video. Anytime we add hyper to a word, this essentially means that we're going to be getting excessive of that. And in this case, we're getting excessive extension. As we look on the injury video again, as Montravius Adams makes contact with Watt's knee, that is essentially going to make that knee go way beyond its normal extension value, placing it in that hyperextension position. And as I do this, you can see this on the model. As I force this model into hyperextension, all of these ligaments essentially are moving. That means that the stress is going through all of these ligaments, and that's why this is such a very risky position for the knee, because any one or multiple of these ligaments can be damaged in this sort of position. Knee hyperextension injuries rarely happen directly from the front going forward. Sometimes they're at an angle, and it looks a little bit in the video where he is essentially tilted slightly to his right. And if this is the case, then what he's getting is he's also getting a force going from the outside coming in, known as a valgus force, and this could bias it a little bit towards that MCL. But as of right now, unfortunately, we don't have a lot of details as to what specific ligament is being affected. So unfortunately, going into a forced hyperextension position like this does put somebody at risk for strains and or tears of any of those particular ligaments located in the knee. Once again, one positive in this case is the fact that Watt was able to actually walk off the field under his own power, so that is usually a good sign in this case. However, there are some clinical tests that we can do to determine if we think a specific ligament is involved. So for example, if we think the ACL is involved, we can do something known as a Lockman's test. And essentially what we're going to do is we're going to stabilize that person's femur. We're going to pull on that lower leg and pull it forward. If we feel like that person is having a lot of laxity in that direction compared to the non-injured leg, this makes us think that the person is dealing with an ACL injury. In this similar position, as the person's lying down, we can do something known as a posterior drawer test. And we're going to push the tibia the opposite direction because this motion here is going to be prevented by the PCL. So once again, excessive movement compared to the non-injured side, we think the person has a PCL injury. If we are suspecting an MCL, we do something known as a valgus test. And this is where we're placing a valgus force going from the outside coming in or lateral to medial. And as I do that, you can see on the model here, that is going to stress the MCL. And then the opposite of that is a varus test, where we're going to place a varus force going medial laterally, and that's going to stress that LCL. Obviously, once again, all of these are compared to the opposite side, and this is going to tell us if we suspect the person has an injury to that particular ligament. Gold standard, of course, is going to be the MRI, and this brings us to the grading system of ligament injuries. And in grade 1, this is where you're getting some straining and no tearing of the ligament. In a grade 2, you're getting partial tearing. And finally, in a grade 3, this is where you're getting a full rupture, which is the worst case scenario. The MRI is going to tell us the severity of the affected ligament. Hopefully it is along the lines of one of those lower grade sprains and not something that is requiring surgical intervention. A lot of times when a person has a grade 2 and up, this is going to create some instability in the knee, and it can require surgical intervention. So we need to wait and essentially see what those imaging results come back as. If I happen to hear any updates regarding TJ Watt's case, I'll be sure to update everybody in the comment section. Also, if you happen to hear anything, please feel free to update me as well. So we wish Watt the best of luck moving forward. We hope it's along the lines of something that requires a much shorter recovery compared to anything with surgical intervention at this time. Thank you so much for tuning into my channel today. If you enjoy this sort of content, I'm going to go ahead and link another one of my playlists so that you can essentially watch some of the videos that I've done in the past talking about other injuries. Thank you so much for tuning in again, and I'll see you next time.